Labia minora is differentiated from the two urogenital folds. What is the pre-undifferentiated genital part of the labia majora? Labioscrotal swelling. Labioscrotal swelling becomes the underscore in males. Scrotum. What sex hormone is used to differentiate female genitalia? Estrogen. What is hypospadias? Abnormal opening of the penile urethra on ventral surface of penis due to failure of urethral folds to fuse. Which penile abnormalite is due to a faulty positioning of HT genital tubercle? Epispadias. What is a featured association of epispadias? Exstrophy of the bladder. Which surface of the penile urethra is affected in hypospadias? Ventral surface. Which surface of the penile urethra, ventral or dorsal, is affected in epispadias? Dorsal surface. What is the description of the gubernaculum? Band of fibrous tissue. What is the male remnant of the gubernaculum? Anchors testes with scrotum. What is the female remnant of the gubernaculum? Ovarian ligament plus round ligament of the uterus. What is the male remnant of the processus vaginalis? Tunica vaginalis. Which vein enters the left renal vein at a 90-degree angle? Left spermatic vein. What is the lymphatic drainage of the ovaries, testis? Para-aortic lymph nodes. What structures are known to drain lymph fluid into the para-aortic lymph nodes? Ovaries and testes. Where does lymph of the body of uterus and superior bladder drain into? External iliac lymph nodes. What structures drain into the superficial inguinal nodes? Distal vagina, vulva, scrotum, and distal anus. Which lymph nodes receive lymph drainage from the prostate, cervix, corpus cavernosum, and proximal vagina? Internal iliac nodes. Lymph of the glans penis drains into the deep inguinal nodes. What is connected by the infundibulopelvic ligament? Ovaries to lateral pelvic wall. What are the structures contained in the infundibulopelvic ligament? Ovarian vessels. What is another name for the infundibulopelvic ligament? Suspensory ligament of the ovary. Why are ovarian vessels ligated during an oophorectomy? Avoid bleeding. In respect to the peritoneum and gonadal vessels, where does the ureter course? Retroperitoneally, close to gonadal vessels. What structures are at risk by ligation of ovarian vessels? Ureters. What ligament contains the ovarian vessels? Infundibulopelvic ligament. What structures are contained by the suspensory ligament of the ovary? Ovarian vessels. Which vessels are ligated during a hysterectomy? Uterine vessels. Which structures are at higher risk of injury during a hysterectomy? Ureters. What does the round ligament of the uterus connect? Uterine horn to labia majora. Which ligament contains the round ligament of the uterus? Broad ligament. What is a classic sign that should raise suspicion of an urethral injury? Blood is seen in urethral meatus. Which are the two main types of urethral injury? Anterior and posterior urethral injuries. What part of the urethra is injured in anterior urethral injury? Bulbar, spongy, urethra. Injury to the bulbal or spongy urethra. DX. Anterior urethral injury. Which part of the urethra is injury in a posterior injury? Membranous urethra. What is the mechanism of injury of an anterior urethral injury? Perineal stratal injury. A pelvic fracture is the most common mechanism to cause which type of urethral injury? Posterior urethral injury. Where does urine leak in a posterior urethral injury? Retropubic space. Leakage of urine into retropubic space. DX. Posterior urethral injury. Where, anatomical structure, is blood accumulated in an anterior urethral injury? Scrotum. Which structure must torn in order for urine to leak into perineal space in anterior urethral injury? Buck fossa. What happens in an anterior urethral injury if the buck fossa is torn? Urine escapes into perineal space. What are the common clinical symptoms of an anterior urethral injury? Blood at urethral meatus and scrotal hematoma. Which part of the nervous system is in charge erection? Parasympathetic nervous system. Which nerves are associated with penile erection? Pelvic splanchnic nerves, S2 S4. What action may be affected by damage to nerve roots S2 S4? Erection. What nerve is associated to cause emission in male sexual response? Hypogastric nerve, T11L2. Which nerve causes ejaculation of sperm? Pudendal nerve.